Very good morning to you. I'm sure you heard my interview there with the Lieutenant Colonel. He says they are facilitating aid convoys into Gaza. What is Médecins Sans Frontières finding?
We are absolutely not able to get the aid required to people in Gaza at the level to meet the needs that the Israeli authorities have created inside Gaza. So this idea that somehow this passive language that's being used about a tragedy that's unfolding before Israel is really challenging for me to listen to. When we are watching the Israeli forces raze Gaza to the ground systemically from the north to the middle of Gaza, and now potentially coming for the south of Gaza, we are watching our team members report back to us and tell us that they can't find food for their family. We have our team members, our Palestinian team members on the ground telling us that they are resorting to eating pet food at this point. And so what has been created, as you said, is a situation of complete desperation for mothers and fathers to feed their children. And so the idea that someone can wash their hands of the responsibility for creating this chaos and creating this moment of complete challenge to the lives of millions of people is difficult to hear. What we need is for the Israeli authority to open up passage of more supply, more people, and to create a space where hospitals are protected, where civilian infrastructure is protected. And as you can see from the images playing on your screen right now, we are nowhere near that at this stage.
OK. The Lieutenant Colonel also told me that there were convoys of aid trucks outside of Gaza on the borders that belonged to various charities, and they weren't doing anything with them. They were just being abandoned there. Have you heard of that?
I haven't heard of that. And myself and the rest of the international aid community has been mobilizing from day one to get everything that we can into the country. And the idea that any of us who are making these massively public calls to get more aid into the country is shirking our responsibility for providing humanitarian aid is incredibly challenging to me. I'd really like to understand the evidence and the specific incidents that they're talking about and what the actual barriers are. Are they the bureaucratic barriers that are being put up by Israel to getting foodstuff into the country? Are they problems at the border crossing? Is it security issues? We would really have to understand better what they're talking about.
Jennifer, what did you make of last night? Obviously, desperation was the word I used, the people climbing on those trucks. The Israeli Defence Forces that were with those trucks, they have an obligation to protect the safety of their employees of the trucks, and the trucks were destined for shelters. It's just an impossible situation, isn't it?
It's an absolutely impossible situation. And MSF was not there, so I'm not going to speak specifically to what happened to that incident. But what I can say is that we are working in Gaza with people who have no shelter, have been moved from their homes, who are suffering from significant injuries, who are unable to get the appropriate surgery that they need, who have mental health issues that are not just going to last through this conflict, but are going to span decades. We have children with suicidal ideation at the young age of 5 years old. We have mothers who are unable to deliver in safe environments. When you put all of this together, it is a powder keg. It is a powder keg for the civilian population in Gaza. And so, of course, you are going to see chaos in this because the desperation is so high.
What about the international community, Jennifer? Just finally, you know, there are talks again going on in Qatar at the moment. The President of the United States thinks that it is moving forward. Is enough being done diplomatically for the people of Gaza?
No. I mean, no. I mean, months ago, we should have heard a very firm call for a ceasefire. And we have not heard that from the international community. We keep talking about a pause. A pause was ridiculous 3 months ago, and it is unfathomable at this point. If you think about the infrastructure and the health situation on the ground, we don't have nearly enough hospital beds to treat people. I mean, the entire health infrastructure is malfunctioning. We're delivering aid as best we absolutely can, but there are still infrastructures that are being fired upon. They are not safe places for people to go. And so, a pause might be able to get food in for a short period of time, but you're talking about an entire area that needs to be rebuilt from the ground up. It has to stop. It has to stop. It has to stop now.